Greetings, everyone, and thank you for participating in our Black Domer series. My name is Tiffany Tatum, and I proudly serve as the Student Recruitment Director of the Black Alumni of Notre Dame. Tonight is the fourth event in our Black History Month programming, where we will spend this month honoring and celebrating the contributions of Black Domers, as well as discussing aspects of Black life, politics, culture, entrepreneurship, well-being, and spirituality. It is our hope that over the course of this programming, we build a community and connect with people globally to reflect upon the contributions made by the Black alumni. The Black Alumni of Notre Dame was founded to enhance the presence and experiences of African Americans across the Notre Dame family, students, faculty, administration, alumni, and alumnae. We hope you will find your time with the Black Domer series insightful, thought provoking, engaging, and actionable. Our goal is to contribute by being a force of good for the entire Notre Dame family. At this time, I'd like to thank the co sponsors of the Black Domer series ThinkND, Irish Compass, and the Notre Dame Alumni Association. And I want to particularly thank our special guests who have given their time and genius to share their experience, expertise, and thoughts with us this evening. If you have questions for any of us this evening, please use the Google form that we are sharing with you right now. Thank you. In addition, tonight, we'll be covering some sensitive topics around mental health as a part of the conversation. If you or someone you know is thinking about suicide and seeking emotional support, there are crisis lines available via phone, chat, or text by dialing or texting 988. You can also access the link to resources that we are sharing in the chat as well. If you are currently experiencing a life-threatening emergency, please call 911. Now, it is my pleasure to officially welcome you to Black Domers, Black Wellbeing, featuring our esteemed alum focused on improving and protecting health and wellness in our community. Last week, we had the privilege of hosting a session focused on Black business and entrepreneurship. We appreciate everyone who participated in and attended the event. Tonight, we are privileged to have distinguished guests with us. Dr. Lakeisha Legree to serve as our moderator for the health and wellness session. Dr. Legree is an accomplished general anesthesiologist, medical consultant, and expert witness. She is the founder and CEO of Dr. Legree and Associates Medical Expert Services Firm, which provides specialized medical opinions for attorneys in various fields of litigation. Dr. Legree is passionate about educating and empowering people to take charge of their health and well-being, and has been featured in numerous publications and media outlets, lending her expertise on a wide variety of health and wellness topics. She is a graduate of the University of Notre Dame 1999 and completed her medical school at the University of Iowa. She is here tonight to moderate our panel and share her insights. Please join me in welcoming Dr. Legree.
Hello. Good evening, everyone. Thank you so much to Tiffany and to the board of BAND, as well as the University of Notre Dame, for having me. I'm very excited about this Black Domer series, and I'm very excited to have an amazing conversation, but more importantly, some thought-provoking and call to action with respect to health and wellness within the Black community. So I am very excited tonight because we're in for a treat. I'm honored to be joined by Wendy Whitsitt and Kimmy Martin. I hope you guys remember them from St. Mary's and from the University of Notre Dame. They will join me on this evening's panel. Wendy is a 2008 graduate of the University of Notre Dame. Well, she double majored in psychology as well as sociology. There she is. Hi, Wendy. She's a licensed counselor and she's currently in healthcare administration, and she brings a wealth of knowledge within her field. Her expertise has been shared in various media outlets on topics related to mental health. So I'd like you to welcome Wendy with me. Hi, Wendy. Thanks for joining us.
Thank you.
Equally excited to introduce Miss Kimmy Martin Troy. Kimmy is a 2000 graduate. Hey, Kimmy, of St. Mary's College, which is our sister college, as you all know, and she currently serves as a trustee there. Kimmy is a certified health and wellness coach, fitness instructor, and wellness workshop presenter with over 15 years of experience. She currently leads yoga and fitness classes at both the University of Notre Dame as well as St. Mary's. She also coordinates with the City of South Bend on various community wellness projects. Her passion for wellness extends to her volunteer initiatives, where she advocates for causes related to mental health, women's empowerment, and social justice. Please welcome Kimmy to the panel, everyone.
Thank you so much. I'm very, it's a pleasure to be here with everyone.
Good, good, good. So we are all very thrilled to be with you this evening to cover this timely and very important topic. There's so much to cover, so let's just dive into it, okay? So first, I want to start with a question about Black health and wellness. But just before we dive into that, I want to reiterate a reminder that we are going to touch on aspects of mental health that may be a trigger for some people. If it's a trigger, please, if you're a current student, call 574-631-TALK. That's the number to the counseling services at the university. Again, that's 574-631-TALK. And if you're an alumni of the university, or if you're just watching because you're wanting to gain more information and anything is triggering for you, please dial 988. Again, that's 988. So moving back to the question that I just brought up, Black health and wellness. What does that mean to you? Who wants to dive in first, Kimmy or Wendy?
Kimmy, I'll let you go.
That's great. Oh, wow. That can encompass so much. I think that for me, I tend to think about it in a very holistic approach. So not just the physical, but also the mental as well, because they are so connected. I mean, I'm a yoga instructor. The word yoga means uniting breath and movement. So all these things that come together. I definitely think that it is not a luxury to think about mental wellness and Black mental wellness. It is absolutely a necessity. So that's kind of my entry point into that realm, or into that conversation of what does that look like.
That's good stuff.
Yes, I was just going to say there's so much to say about all of those components and really looking at our holistic well-being. What does that mean? And even having the insight to check in with yourself and to really determine where you're at. How are you feeling in that moment? And being able to cope with stressors or, remove any additional stressors that you're able to, but definitely looking at that whole person picture.
Yes, I'm so glad you all said whole person picture. And Kimmy, I'm so glad you talked about mental health and its connection to physical health. I kind of have two perspectives, well, really three perspectives. One, I'm Black, obviously. Two, I'm a physician, but also three, I have to go to physicians and doctor's appointments myself. I think in my role as an anesthesiologist, the biggest thing that I I find within our community is a lack of knowledge. And as a direct result of the lack of knowledge, we don't advocate for ourselves. So, for example, as an anesthesiologist, I'm sort of your first line of defense in the operating room. So I have to go over your entire medical history. And you'd be surprised within the Black community how many cases of high blood pressure I catch. You come for surgery, you had no idea how many cases of diabetes we catch. You come for surgery, your blood sugar is through the roof. You have no idea. And so I bring that up because I don't think that as a community, we are necessarily doing the best with respect to seeing a physician, having those checkups, having those screening exams, having that blood work done. And then also, secondary to that, I think perhaps we as a community can also do a better job with teach one, help one, or help one, teach one, however that saying goes. You know, if you yourself are doing the right things with respect to your health, check on somebody else, whether it's a girlfriend or a family member, and make sure they're on top of it. And there are reasons I think that a lot of people don't go to the doctor, which brings me to some myths and some barriers within the community with respect to healthcare and well-being. Can you guys think of any myths or barriers that you have seen within your line of work?
You know, you had touched upon the advocacy component and thinking about how important it is to connect to your providers and to be heard and seen by them. I think that that is so important, and having that connection so that you do get adequate follow-up care, so that you do get screening and there's follow through and just the health outcomes that come with that.
Yeah, definitely, definitely. Kimmy, do you have any thoughts on like myths or barriers that you've seen in our community with respect to healthcare and well-being?
Absolutely. The one myth that I immediately comes to mind, I know that we chuckled about it a little bit, but that Black people don't need sunscreen. So even just simple myths like that, it's like, oh, the melanin, it provides a barrier. I mean, I was an adult before I learned that that is not the case. There are certainly cases of people of color who have passed away from some type of skin cancer, or so that's the first one that popped in my mind. But there are really just so many things that are handed down generation after generation, and not for anything that's like an ignorance, but really just a matter of not diving deep or talking or having these conversations with other people that do know, who may have the facts. So I think that that's definitely something that is the reason why we're gathered here today, to have these conversations and make sure that we are bringing these types of conversations and these myths to the forefront so that we can provide accurate information.
Definitely, definitely. I'm so glad that the university has sponsored this. I think this hopefully will be one of many where people can come and get some accurate information with respect to health and well-being. So speaking of skin cancer, I'm no dermatologist, y'all, but as a physician, yes, we can get skin cancer. It's called melanoma. Okay, so the preventative route is having a skin surveillance exam at least once a year, particularly if you have a family history of skin cancer or melanoma. What that basically is, you go to a dermatologist and they look at your skin from head to toe. They look for any irregularity in spots. Sometimes Black people or minorities in general, we have what appears to be a mole, but if we don't pay attention to those moles, they can actually morph into something that may be dangerous. So what are you looking for? As you do your skin exams, you can even do this in the shower like you're doing a breast exam. You just pay attention to different spots, and if you think that the color has changed, perhaps it's gotten darker, if you think that the shape has changed, if you think that the texture has changed, for example, it's no longer flat and smooth, it's maybe a little bumpy or a little rough. If it's causing any pain or irritation, these are all things that you don't want to kind of brush off. You definitely want to get that skin surveillance exam. And I encourage you to seek out a dermatologist who looks like you, because having experienced medical school, not all textbooks will show what certain skin cancers look like in patients with a lot of melanin. So that's just a tidbit with respect to skin cancers. So yes, it can happen. So put that sunscreen on when you go to the beach, people, please. Let me see, what's another one? I know one. My great grandmother used to always talk about trust issues within the medical community. And I used to always ask her why, and probing and getting additional stories. I think the trust issue stems from history with respect to things like the Tuskegee syphilis issue. I think amongst our seniors, or some of our seniors, believe it or not, they would actually either not go to the doctor because they don't trust the doctor or the healthcare system in general, or I've actually had some senior patients on the other end of the spectrum who actually look like me, and these patients will say that they trust majority physicians, European physicians or of European descent, more than they do a physician that looks like them. And that kind of that blew me away for a minute. And at first I didn't understand. But Kimmy, you were telling me something the other day about that.
Yes, my grandmother, who I just adore, from Montgomery, Alabama. She's long gone, but I do remember her expressing her mistrust of, or rather, not a mistrust in the person as an individual, really this lack of trust in the institutions that may have educated young Black doctors. So thinking that perhaps they might not have the same quality of education as their white counterparts at that time. So, and I don't think I really realized that that is a very common thought process, like you mentioned, among seniors especially. So we kind of laugh about it with her now as we got older, but it's a very real thing, especially when you are in the South. And I mean, I'm talking, she's civil rights worker, so in the mix of it all. But really still, there's just those, again, those generational thoughts that are handed down, that are ripe with misinformation, disinformation, whatever you want to call it. But we have to call it out. We have to call it out, and we have to educate our community.
Exactly. Hence forums like this. So I don't want to discount history, because that did happen. Research on the development of the antibiotic penicillin stemmed from Tuskegee syphilis issue. And the gist of it, I'm sure everyone knows the story, is African-American men were basically inoculated with the syphilis virus and purposefully not given treatment, even though they knew the antibiotic penicillin could treat it. And the purpose of that study was to see what the long-term effects of syphilis would be. Clearly, that is a violation of human rights, of ethics, of everything under the sun. So there is validity to why our senior citizens still have that persistent mistrust. But I think as generations pass on information, I think perhaps it also needs to be passed on that the more questions you ask of a provider, the more information you'll obtain. And knowledge is power, right? The more you know, the more confidence you'll have in that person. And I encourage you, again, in this situation, to seek a provider that looks like you. There are multiple studies that show that when a patient has a provider that looks like them, they have better health care, their life expectancy is longer, they tend to have better preventative care as well, as opposed to reactionary care. Again, this is not a blanket statement. Not all majority physicians practice reactive medicine, but this does happen, and I would be remiss as a doctor not to mention it. Part of the reason is because of implicit biases and systematic racism. So in medical school, they don't teach you that different things can present amongst different patient populations. So for example, the way a heart attack presents in men is different from the way a heart attack can present in women. The same is true for races and cultures as well. And the other thing to remember is that a lot of times certain medications work differently in different patient populations. So for example, ACE inhibitors for blood pressure, or some of you in the audience may be on something called hydrochlorothiazide or HCTZ. A lot of times they find that those medications work better in the African American population with respect to blood pressure and the prevention of kidney disease as it relates to high blood pressure. So the more you know, and sometimes Dr. Google is your friend, but the more you know, the more you can arm yourself with information, and knowledge is power. Wendy, what are your thoughts about mental health with respect to myths or barriers?
I was just thinking about how Kimmy said there's not discussion always, and how there's the stigma of mental health oftentimes, and being able to have these discussions, like what am I going to look for? What, when do I need to be worried about something? What can I do to protect myself and keep myself safe? If we're not having the discussions, then they can remain mysterious. And sometimes if we don't give a thing a label or a name, it allows it to fester and be a little bit more scary than it is.
Yeah, definitely, definitely. I think in our community, there's a negative stigma associated with mental health issues, whether that's feelings of sadness, feelings of hopelessness, feelings of signs and symptoms of depression. A lot of times in our culture and our community, based upon history, we are taught to be strong, to forge ahead, to put your head down, put the blinders on, one foot in front of the other, keep going, keep marching. And although those things in our past have generationally developed this sense of resiliency within us, Black men and Black women, particularly Black women, I think it's also it's like a gift and a curse, right? It's a gift that we're so resilient and we're so strong, but it's a curse because you have this sort of, syndrome. I call it the superwoman syndrome or the Superman syndrome, and that the Black woman can do it all. We can handle it all. We can forge ahead. We can have the world on our shoulders and 50 pounds on our back and a gallon strapped to each ankle, and we're still gonna be fine. Men, be strong, be tough, you're a wimp if you cry. There are other colloquialisms I won't use, but you're not supposed to show emotion. All those things are barriers to men and women of color coming forward to say, hey, I'm not okay. I'll be the first to say, and I think transparency and conversation is what will open the door to feeling comfortable as a patient, as a person, to talk to your friend, your mom, your family member, your pastor, your doctor, anybody about what you're going through. And there's so many options out there that we'll review later that you don't even have to leave your house. You just pick up your cell phone. There's apps, there's telemedicine. There's so many options out there to get help. That I think that the more transparent you are, that the more conversations like this we have, the more we can encourage people to be honest, speak your truth. I'll lead the pack. Hey, I'm Dr. Legree. I have a history of depression and I have treatment. And guess what, y'all? I'm still fabulous and living a great life. My friend sent me this picture a while ago that says that you're not a failure, you're just a girl who slays and fails even as she slays. And I framed it and I still have that. So, you know, it's okay to not be okay all the time. You just have to have the courage to talk about it to somebody.
I think too that, oh, sorry, Wendy.
Go
I
ahead.
was just gonna say that I think sometimes too, we don't notice when something's not right. When I look back over the course of my life, I have a history of anxiety, depression as well. And so looking back, it's always kind of explaining it away. It's like, well, well, it was a really rough week, or I think I really admitted that there was when I needed to talk to somebody after I had my son, my first child. New mom, didn't know what I was doing. So, but really just kind of thinking like, okay, well, they're saying watch out for the baby blues and watch out for if you feel like you're going to hurt someone or anything like that. And but I couldn't really put a label or explain what I was feeling. But it wasn't until he was about 9 months old that I discovered, okay, no, there's really something going on. Um, I definitely just again trying to explain it away, trying to not minimize it, but just there wasn't a name for it. Again, I bring up my family because I'm very close to my family. I'm very close to my parents. Hi, mom and dad. They are wonderful people. But I remember talking to my mom in those early days and asking her, no, do you ever feel depressed or anxious or anything? And she's like, girl, I didn't have time to be depressed. So now and with them both learning and me talking, it's just kind of like, okay, she's like, no, this is a real thing. So we're really teaching and sharing by talking other generations before us that these are things that need to be talked about. These are very real things. And that could also fall in that myth as well, and that super women, all the things, men too. This isn't just about women's wellness, but really it's just about as a collective, as a community, we have to talk. If something's a little off, let's not sweep it under the rug. I heard the greatest saying from a friend of mine saying, when you sweep things under the rug, you're just creating more bumps to walk over. They don't go away.
Definitely, definitely. What festers in the dark? Bad stuff, bacteria, organisms, negativity. You shed light, then that's when things start to come out on the forefront and you can discuss it. And it's a journey to getting better. It's not a destination. It's constantly evolving with respect to your road to recovery and maintenance and stability, speaking from experience. But you made me think about something, Kimmy, and Wendy, you have to tell me if you've experienced this too. I'm a spiritual person, and most people were grown or were raised in some sort of religious environment, whether that's Christianity, Jehovah's Witness, whatever. But my grandmother used to say, and my mom sometimes, girl, you got to pray. Have you been praying? You praying hard enough? Just take it to the altar, give it to Jesus. And as a physician, I'm all about spirituality. If my patients will say, doc, before we go into the operating room, will you pray with me? I'm definitely going to hold your hand and bow my head and allow whomever is with you to pray. But as one of my friends who's a breast surgeon said, yes, take it to the Lord in prayer, take it to the altar, but I need you to realize that that higher power, that Jesus, he gave me the ability to cut your breast cancer out. He gave me the ability to put you to sleep for the surgery and wake you up. So at the same time that you're trusting and praying, I need you to recognize that these are skilled persons, whether it's a counselor, a therapist, a physician, a teacher, whomever, that have the skill sets to help you. Sometimes it's the combination of things that help you get through that journey. It's healthcare in the form of faith. It's healthcare in the form of, medications. It can be prescription medications. It can be alternative therapies in addition to prescription medications, such as herbal alternatives. Everything I want you guys to know from a pharmaceutical standpoint stems from a plant. If you go to the National Museum of Botany in DC, they have a whole pharmaceutical exhibition about which plants have been the root of certain medications. So it's not just one thing that will get you there. I think it's a combination of things that you put together, kind of like a good gumbo. If you're missing the sausage, the gumbo, it might be good, but it's not going to be great. You need a little bit of everything in there to help you get to where you need to be.
I love that. I'm going to remember that.
The gumbo. I just made myself hungry. Speaking of hunger, I'm going to segue into another topic with respect to healthcare. We're going to talk about a couple of issues. We're going to provide you with some medical knowledge, but we're also going to talk about the other elements within that gumbo soup that can help you, and we'll provide real life examples as well. Some of these real life examples you may have heard about in the media. And then we'll just continue to have dialogue and discussions. And remember, guys, you can submit questions. They can be questions about what we're talking about. They can be medical questions, whatever you feel is on your heart. Please, this is the time and the forum to put those questions out there. So the first thing I want to talk about is screening exams, right? Screening for breast cancer, screening for colon cancer, screening for skin cancer, like we already talked about, screening for high blood pressure. There are so many screening exams, screening for prostate cancer that are out there that are big with respect to preventing cancers from occurring or catching cancers early. The earlier you catch or diagnose a cancer, the better the outcome with respect to life expectancy and what we call prognosis. So, for example, colon cancer, right? So the average patient or the average American should have a colonoscopy beginning at the age of 45. It used to be 50, y'all, but then it was changed to 45. And that's a screening exam. Okay, you're not having any signs, you're not having any symptoms, no blood in the stool, no blood in the toilet, no difficulty going to the bathroom. It's just pure screening. If you have a family history of colon cancer, then you need to back that up by 5 years. So that means age 40, you need to have your first colonoscopy. I had my first one. Actually, God, I'm not even going to talk about it, but it was fine. I'm still here. I had the best sleep ever. You just go and the prep is terrible, but I lost a few pounds, so that was good. But the screening exam. So the colon colonoscopy is probably the screening exam that prevents the most number of cancers overall, inclusive of other cancers beyond colon cancer. All it takes, y'all, is you drinking some milk of magnesia type stuff. You go, you get an IV place, you get the best sleep in your entire life by an anesthesiologist or a certified registered nurse anesthetist. They use a scope. They are looking at the large intestine, not the small intestine, the large intestine, in addition to the colon, in addition to the rectum. And what they're looking for are things called polyps. Polyps are, if I can give an analogy, like out pouches within the colon or within the large intestine, or like super large pimples. And if one is seen, they are considered to be a precursor to cancer. During the colonoscopy, when polyps are seen and found, they are immediately removed, thereby immediately removing, not reducing, removing your risk of colon cancer. Some people, however, will wait until they're symptomatic. So, for example, if you have been having constipation, if you've had weight loss that's not intentional within, let's say, the past 3 to 6 months, if you are still able to do number 2, but it's very thin, it's very pencil-like, it's skinny, it's not the normal color, there's blood present, that's a sign as well. Abdominal pain is a sign, bloating is a sign. So all of these things, don't take it lightly. Talk to your doctor about it, and depending upon your age, definitely request a colonoscopy if the physician doesn't tell you you need a colonoscopy. So one common example that I think all of us are aware of is the actor Chadwick Boseman. What did y'all think when y'all heard about him?
It was so surprising. Yeah, it was really, I was sad to hear about it. And, I think a lot of other people were really surprised. I didn't know him personally, but I still felt connected.
Mm-hmm, mm-hmm.
Same, Wendy. It was just so shocking. And I think the more that came out, it was colon cancer that he passed away from, right? So I think as more things came out, um, he seemed like he did have a support network around him that did know what was going on, but the public did not. So I think that's just what was so shocking. I do want to backtrack for a very quick second, Dr. Legree, also that there is another option other than the colonoscopy for people to use. It's the at home.
Yes. Mm-hmm.
That's another option. So again, it's just about, if you have a history or family history of anything in that area, then obviously perhaps you might want to go for the full on, the real deal. But yeah, there are just so many, there's options out there. And of course, that's just what you want to talk with your doctor about. But I did not know until Chadwick Boseman, I didn't know how prevalent it was in our community as well. And then lucky for me, they lowered the age to 45. So I was like, yay. But I mean, it's all about screening and preventative, as you said, and just doing all the things that we can, not reactive medicine, as you said. So
Yes, and just to provide some additional information, ladies and gentlemen, what Kimmy is referring to is a home test to assess for blood in the stool, or microscopic blood in the stool, blood that cannot be visualized with the naked eye. What happens is you put a smear of stool onto a card, and you send that into a laboratory, and they assess for heme, which is the medical term for blood in the stool. If that is present, then that is a risk factor, and you should have a colonoscopy and not pass go. However, I do want to say that that stool exam at home, although an option, is not the best option. The gold standard preventative screening test is colonoscopy. So I just want to be clear about that. Let me think. Oh, something else. Let's talk about type 2 diabetes, or just diabetes in general. Did you all know that the majority of the population, particularly Black people, like 1 in 5, have type 2 diabetes? That is super, super preventable. Type 2 diabetes is different from type 1. Type 1 diabetes is a genetic component to it. It means that your body does not produce either any or enough insulin to regulate your blood sugar. A lot of times, type 1 diabetes is diagnosed in adolescence or in teen years or young adult years. Type 2 diabetes, however, the risk factors for that is high cholesterol, high blood sugar, which is a direct correlation to kind of the culture in terms of food that we grew up with. We have to be very cognizant about what we consume from a dietary and a nutrition standpoint. It's okay to have that comfort food, but don't have it every day and don't have it every week. Fried foods, as a physician, I can't say it's okay, but as a Black individual, it's okay, but in moderation, because I love me some fried catfish. So everything in moderation, you guys. And then we have to move our bodies too, right? So, I know everybody can't be like Peloton and, all this CrossFit and all this like exercise madness that's on social media now. Keep in mind there are filters everywhere, y'all. But we can at least move our bodies. For example, don't park close to the door, park further away from the door. So you have to walk. Don't take the elevator, take the stairs. Even if you're an older person, a senior citizen, I remember my great grandmother actually was in her 90s. She would sit in a chair in the kitchen with the daytime soap operas on, and she would take those heavy progressive soup cans, and she would just move her arms sitting in the chair. She would sit in the chair and she would just lift one leg, lift the other leg. So there's different things that people can do based upon age, based upon activity levels. But the point is to move, because movement will impact the metabolism, and the metabolism will impact the blood sugar. Type 2, I don't think I said diabetes, is when you have a resistance to insulin. So your pancreas is definitely producing it, but for whatever reason, your body is like, I like this sugar. It's so much sugar in the body. Ooh, I love glucose. I love sucrose. I love fructose. Forget that insulin. And so it just won't respond to the insulin that the pancreas is producing. And speaking of insulin, it's okay if you have progressed from taking oral medication, i.e. metformin for your diabetes, and you now take insulin. A lot of times in the Black community, minority community, they think if you have to start taking insulin, that it's like a death sentence. Oh God, I don't want to take insulin. Oh God, not the sugar. You just do what you have to do and know that you can make changes through diet, nutrition, and exercise. But those are some things that I've been saying as a physician. And again, all of these things can either be prevented with respect to type 2 or managed with respect to type 1 and type 2 with information, with knowledge, which means you have to be active in arming yourself with information, which means you have to be active in going to a physician. Because it's much easier to prevent things than it is to be reactive and try to minimize things once you get there. I think, Kimmy, you were watching a podcast or listening to a podcast the other day. What was it saying again? I forgot.
Oh, it was just maybe 2 days ago. So timely for what we're talking about. The podcast is called Start Here. It's an ABC News podcast they do every single morning. And a lot of times they'll repurpose the content into an article. And this was the same. So you could look on abcnews.com. So this was about the rise in amputations among in the Black community, especially in the South, Black and Brown communities, and as a result of the rise in diabetes. But they were saying that the rise of amputations was kind of outpacing people with diabetes. So a lot of the again, some of the doctors are imposing their own thought processes about people saying, well, you know what, I think we're going to just have to go ahead and cut off the toe because you might not get back in here for preventative care. But I just thought that was absolutely fascinating and so upsetting, that this is certainly a study that's still going on in 2024 with the knowledge that we have now. But yeah, that there is quite a, which again lends to the point of what you were saying about going to a doctor very often that looks like you. Very often the studies show that people are more apt to do what they need to do if someone who looks like them, or also just getting a second opinion, going to another, you're just really having to advocate for yourself.
I was
Yeah.
thinking the same thing, the advocacy and being able to ask questions like, is this the least restrictive intervention that I need that's going to help me? And asking what are other options, what's available to me as well. And that applies. I've done that for my physical health as a patient. And then you can also ask those questions with mental health providers too.
Yeah, definitely. You both brought up some great points that I just want to expound upon based upon what I've been saying. So with respect to amputations, irrespective of the limb, most African Americans or brown and Black communities have not just toe amputations, but also what we call BKAs, below knee amputation, or AKAs, above knee amputation. And although the majority of time it's necessary because of the severity of the diabetes, I do want to bring up the issue I mentioned before about implicit bias. So for example, there are some studies that have shown that some majority physicians will automatically make the assumption about whether or not a minority patient will be compliant with their treatment. Will she or he return for a follow-up visit in 3 months? Will he or she take the insulin as prescribed? Will he or she do the foot exams as instructed to? And because the implicit bias automatically turns negative and says, oh, they're a minority, chances are they're not going to show up. They will move you towards amputation, which is the last resort, as opposed to progressing you through, for example, okay, let's try increasing your insulin, come back in 2 weeks, keep a journal of your blood sugars, let's see what the trend is, that type of thing, to see if perhaps you can, get it under control. And I bring this up to say that it's not necessarily on purpose. These are biases that a lot of majority physicians don't even know that they have, because they too have been taught these negative things about minority patients from generation to generation. Same thing I can say about pain. There's a perception with some not all, I wanna be clear about that, some majority physicians, that minority patients have a high pain tolerance. Well, what kind of nonsense is that? Nerves are nerves, right? But a lot of times when you come into the emergency room complaining of pain, oh, you can't be in that much pain. Oh, you just want narcotics or opioids. Or even more so now, I'm seeing in the maternal health world, which is a huge topic within the minority community, not only is pain not taken seriously, but really any sign or symptom that you're feeling is not taken seriously because of that implicit bias. So I say all that to say it is so important to have the knowledge, whether that's you Googling on your own, or whether that's you asking a friend, or whether that's you having a physician that looks like you that will educate you so that you can then advocate for themselves. You can ask a doctor anything. We're humans too. If you ask for a second opinion and a doctor balks, walk away, get another doctor. Any physician that balks at a second opinion, in my personal opinion, I'm not speaking for all MDs, I think I'm not saying they have something to hide, but I'm just saying they have something to hide, okay? Second opinions are okay. It's just like car shopping. You don't just buy the first car from the first salesman. No, you do your homework, you do your research. And it can happen to anybody. Implicit bias can happen to anybody, irrespective of socioeconomic status within our culture. Another high profile example I can bring up is Serena Williams. Serena Williams, when she had her daughter, her first child, suffered from something called a pulmonary embolism, which is a large blood clot that can lodge in the lungs and cause instant or immediate death. She was complaining of shortness of breath, she was complaining of pain, and she wasn't taken seriously. And those types of things, whatever you're feeling, you know your body best. Okay, so if somebody says, I don't know what's going on, I've never heard of that before. So what? I'm feeling it. It's my body. I know myself the best. Just like, an analogy I can give is a mother-child scenario, I don't think your son would do that, or I don't think your daughter would do that. Guess what? I'm mom. I know my child. You know what I mean? So you are the best advocate for yourself because you know what you're feeling. You know when your body is off. So don't hold that in. Use your voice. Open your mouth. And if you're not believed, ask for someone else. Ask for a supervisor. That is okay. No one should take offense to that because at the end of the day, you only have one life. And who cares who gets offended by you advocating for themselves? That's my soapbox.
There's so much to touch on, even with that pain component and not being believed. There's a whole segment on medical trauma and experiences related to that. Goodness, I feel like we could go on and on, but it is so important to have that validation, right? To go somewhere and you're trusting this person with your health and in some instances with your life, and then to get invalidated, that can be really difficult.
Absolutely. And then to have to go back, whether you go back to the same doctor or whether you have to start all over to try and go somewhere new, it can definitely be taxing and yeah,
Yeah.
And
challenge.
discouraging, but like I said, you only got one you.
Exactly.
You
And
don't
some
advocate
people,
for you, who will,
right.
Yeah.
And some
Um,
people don't want to have to start over, right? Oh, I already gave my history. I already talked about this. And so then you're kind of torn between, do I go find someone that I'm going to align with that I feel has my best interest? Or, do I stay with this scenario because I'm already established under care?
yeah. You made me, Wendy, think about another thing that I want to point out is judgment. My personal opinion within our community and our culture is that we're quick to pass judgment. Thinking back to the Chadwick Boseman scenario, everyone was passing judgment on how skinny he looked, as opposed to wondering, you know, something's not right, something's off, you know. A lot of people will pass judgment on perhaps if you're asking too many questions. Um, so what, they're asking too many questions? You know, they're asking questions because they're trying to inform themselves so that they can best advocate for themselves. And the tables are turned. As a provider, sometimes I've had patients say, I already answered that, doc. Like, why am I answering the same questions all over again? And my response to that is, I know you answered these questions before, but I can't trust necessarily what's written in the chart. People make mistakes, electronic medical records, they've been transcribed from whatever your paper record was into a computer system. Everybody can make mistakes. So I want to hear from the horse's mouth X, Y, and Z. And you'd be surprised, there are mistakes in some people's medical records, whether they're allergies or whether it's medication that you're taking. So if your doctor comes in, or the nurse comes in, or the medical assistant, or whomever, and you are like, oh my God, if you ask me this one more time, just have a little grace, have a little patience. It's actually for your safety that these questions are repeated. So, you know, a lot of times we can be quick to get tense and terse and pass judgment on that too. I want to shift. Go ahead.
Oh, I was just going to say, even just today, there was something in the news, or the last couple of days, Wendy Williams. There's been some talk. She's had some health troubles. I'm not exactly sure exactly what the diagnosis has been or what's been going on, but she's emerged today. I think there might be a documentary coming out about her. I'm not sure what channel, but anyway, there's been a lot of judgment and comments about her appearance. And she's going through probably one of the hardest times in her life. Um, I think she also has some type of dementia. And this is just something that now she's choosing to share, to be a part of the conversation, to let people know what's going on. And that's something that should absolutely be applauded, not criticized. I think that the documentary is going to be on Lifetime, actually. So definitely worth a look if you get that, or worth looking into her story.
Yeah, definitely. That just made me think, you know, recently, in the past couple of years, a lot of famous people within our community and our culture have been coming forward with their truth, with their transparency. And it has prompted dialogue and conversation and provided education for the community because everybody has somebody in their family with similar signs and symptoms to something you're seeing on social media or you're seeing on camera. I can think about, just to touch on Wendy Williams as an FYI, she is suffering from a thyroid disorder, you guys, called Graves' disease. And her appearance, excuse me, particularly her face and the eyes that look like they're protruding, that's a sign of Graves' disease called exophthalmos. So yes, it looks, you know, a little weird. And historically, if you go back and look at a lot of Wendy Williams shows, she's always had that. It's getting progressively worse now. So that's an example of perhaps that may have been an undiagnosed thyroid issue before she even became aware of it. So, you know, now don't go around to every family reunion talking about your eyes look like you're thyroid disease.
Right.
Don't do that. I'm just saying, if you recognize a change within yourself, that could be a sign or symptom. With respect to mental illness, I think about Taraji P. Henson. She's been very transparent. She's been absolutely phenomenal with respect to being transparent about her journey. She's created the Henson Foundation, which I think is in honor of her father or her grandfather. She's been influential in developing mental health programs with a lot of historically Black colleges and universities. And so she's opened the door to making dialogue about mental health more comfortable to talk about. Again, it's okay to not be okay all the time. What's not okay is to hold it in, to compartmentalize, because the more you hold things in, the more you don't talk about it, the more you think, I got this, I'm strong, I got this, you're going to hit a brick wall. And when you hit that brick wall, you're not going to be able to pull yourself up by the bootstrings, so to speak. So have no shame. There's no shame in being transparent about your health. At least be transparent with your physician or your healthcare provider. And if comfort talking with someone that looks like you is a factor, then find someone that looks like you. I will say there's a shortage of mental health providers, particularly mental health providers that look like brown and Black patients. But don't let that stop you. Ask a friend, go on Facebook, go on Instagram. There are lots of apps. Don't give up on yourself, because again, there's only one you. And it's very important that you talk about it. I wish somebody should do this. Somebody should do a documentary on famous people and just have them have a transparent, like, dialogue about their medical issues, whether it's physical health or whether it's mental health. I feel like we have these documentaries about everything else, love and life and dating and this and that, but there really hasn't been, at least as far as I know, any documentaries about that. I know that there was one, though, that I applaud on the OWN channel about the problem of in vitro fertilization and just infertility amongst the Black and brown community, which is a whole nother topic in and of itself. I think it's called Eggs Over Easy, and it's on the OWN channel, and it was spearheaded with Oprah Winfrey and Keisha Knight Pulliam. She was transparent about her infertility journey. So if there's anybody out there in the audience who is struggling with infertility, I encourage you to watch that. That documentary has a wealth of information. So if there's any writers, producers, anybody out there that knows people who knows people, I think that documentary would be super huge. But anyway, I digress. Are there any other? Oh, yes, let's touch on mental health. Wendy, yes,
Awesome. Okay. I
thanks
was
so
just thinking
much.
how we have not quite danced around, but we've talked, right, about community, that importance, the spiritual component, and that in and of itself can be a coping skill. How a lot of times the spiritual leaders can be a first line of defense, and there can be spiritual and faith-based providers that are available as well. So in looking back to that discussion on judgment and community, how important it is to know that you're not alone, that isolation being a risk factor, and really leaning in to the support group. And again, I'm wanting to touch on, I'm that super person, right? I should be able to do it all. And sometimes when people want to help you, it's because they want to thank you for what you've done for them. And sometimes they want to be able to do good for you like you've done for them. And so allowing those other people to have that space to flourish in that way. Yeah, I'll pause there, but I could keep chatting.
You know what? Actually, bringing kind of going off of what you said as well. There are there are so many. One of the wonderful things that came out of COVID, there are a few things that did. Um, the rise of telemedicine,
Mhm.
and we're not having to just be just be within our particular state, see someone who's locally in our area. I certainly know that money can be an issue, but services like BetterHelp, I know that there's some other services out there as well. You can select what type of therapist that you're looking for. Is it something that's just general chatting? Is it something that's a little more serious? Are you thinking about want someone who's within the LGBTQ community? Are you looking for an African American doctor? It is so, I hesitate to use the word easy, but I will say, more accessible. The information is more accessible now than ever in terms of where the resources are and where we can get our information. And Wendy, just like what you were saying, if we don't know, then we ask somebody else that might know and have that kind of information. But yeah, telemedicine, I mean, even just chatting. I think BetterHelp, one of the choices, not from experience, but yes, but one of the choices for who you can select is if you want to chat. Do you want to do it by video, by Zoom, or do you just want to do it over text? So many options for people like us, especially in our American culture. We're so on the go all the time to make mental health resources more accessible in our daily lives. We're connected to our phones all day, every day. So to be able to chat with a therapist, I mean, if that's something that's needed, then we can do that. That is, they even have gift cards for mental health. It's amazing the resources that are available in mental health today.
Yeah, yeah, there's almost like no reason not to be able to access something. Wendy, can you give us a little insight on how therapy works? I think that's another kind of barrier within our community and our culture. I'm just gonna go out on a limb and say, especially with Black and brown men, with respect to therapy, I'm not going to therapy. What do I need a therapist for? You know, we just talk about it at home and then that's it. So can you give us a little insight on what therapy looks like, Wendy?
Yeah, so, initially you'll come in or telehealth now, and there will be an assessment screening, taking that inventory, some of those questions, just to really better know where you're coming from, what kind of adverse or potentially positive childhood experiences you've had or other historical experiences, just so that provider can get a better pulse on where you're at. And then the provider will make a treatment plan with you. And that's something that should be collaborative, where you're engaged in that process, identifying like what's bringing you in, what are your concerns, and then together identifying how the provider is going to work with you. At that point, they're going to go ahead and do some interventions with you. Some providers assign, they call it homework. Um, Personally, I only do homework like that I've done. Like I don't want to assign something that I haven't done. And then have them go out and try to figure it out. But sometimes there's homework involved, and other times they're using other evidence-based practices. And that's really important to make sure that they're evidence-based. And you can ask the providers too, how is this scientifically proven? And what kind of outcomes are typically expected? What is the treatment for my diagnosis? What kind of treatments are available? So I hope that's and I guess another factor for someone who might not know, you'll chat, you'll talk. There's a lot of talk therapy, and then there are prescribers. And those, depending on the state, there's different licensures, and they can prescribe psychotropic medications.
That's awesome. Um, We have, I want to kind of give some education on signs and symptoms of certain mental illnesses, as well as sort of what to look for in loved ones, and a little more detail about treatment. And then we can talk about it some more. We do have a slide because I really, really, really want to put a face to what I'm talking about. So if we can put that shine a light on mental health slide up, that would be fantastic. Ah, yes, look at these beautiful, beautiful faces, guys. So what I want to point out is a couple of things. So there are various diagnoses under the umbrella of mental health. What we're most familiar with is anxiety and depression. There's also PTSD, post-traumatic stress disorder. It's not just veterans who suffer from PTSD. There's also schizophrenia. Yes, Black people can have schizophrenia. There's also suicidality, which is thoughts of causing harm to yourself. There's also bipolar disease, which is a combination of mania and depression. The other things that I want to bring up is that not everyone displays their mental illness externally. So what do I mean by that? When we're talking about depression or when we're talking about anxiety, some of the most common signs and symptoms are change in routine. Perhaps that girlfriend isn't picking up the phone as often or as frequently as she would. Perhaps your friend's not showing up to play ball at the park like he usually does. So out of ordinary behavior. Isolation, if you find friends are isolating themselves from friends and family. Missed days from work, missed days from school. Crying for no reason, spontaneously out of the blue. Perhaps excessive drinking, perhaps new substance abuse. So these are outward signs and symptoms of depression. There's another form of depression called functional depression. What do I mean by that? So you have a lot of executives, C-suite executives, company owners, CEOs, physicians, attorneys, professionals in general who are very good with hiding their depression and their anxiety. I say a lot of times they'll put the face on for work, and then as soon as they get in the car, the face comes off. And what do I mean by that? We're good at masking for a few hours until we're not. And so that saying sometimes that's been circulating amongst social media, check on the strong ones, check on your strong friends. That's what they're talking about. And faces to that is, for example, Twitch. Twitch was a infamous choreographer and DJ, and was infamous and influential with his role on the Ellen DeGeneres show. According to his wife, everything was fine until they were not. Chelsea Christ, Miss USA 2019, beautiful girl, attorney, correspondent for ET News. So on the outside, it looks like she's got it all, right? She's beautiful. She's a news correspondent. She's on television. She's an attorney. It looks like she's living the life. But I want to caution you that what you see is not always what's going on the inside. Case in point, what you see on social media is a snapshot of someone's life. It's a filter of someone's life. It's not the reality of someone's life. So I put these pictures up there because a lot of times within our community and our culture, we put on a good outfit and put on some good lipstick and we think people won't know what's going on. Instead of masking it, we need to have the courage to be transparent, to talk about it. The other face that I want to bring up here is Miss Candia Bailey. She was the Vice President of Student Affairs at Lincoln University. She, on the other hand, was very vocal in trying to get help in the workplace because she was suffering in the workplace. And unfortunately, it fell upon deaf ears. And in this scenario, if you're at work and you're not getting the assistance that you feel that you need from your supervisors, please use the resources that may appear on the back of your insurance card, employee assistance programs. So those are very helpful. If you feel like you don't want anyone to know, which is what happens in my profession as a physician, one physician dies by suicide every day. Physicians, they're the highest profession with the highest suicide rate amongst all professions, but you wouldn't know that, right? So I say all that to say, whatever you're feeling or whatever you feel that you're not feeling, the main point I'm trying to get across is to start talking about it. I don't care who you talk to, just start talking about it. Even if you're somebody who talks out loud or thinks out loud or manifests out loud, getting that out of your body, out of your mind, into the universe will help free up some of that congestion that's going on mentally. And note that the mental is connected to the physical. So if you don't address the mental, it's going to manifest as physical as well. So what are some kind of things do you guys think that we could be doing better as a community with respect to mental health, with respect to preventing this kind of stuff from happening?
So I want to touch on, sorry,
Go ahead, Wendy.
Thanks. Just thinking about, I can't remember the exact words that you used, but along that colloquial term, high functioning depression, right? And that's not a clinical term, like we don't have that like clinically in the DSM, but that idea that people can have depression or symptoms of depression and the severity of that, the acuity of that can have a range. I'm thinking of like risk factors and vulnerable populations, first responders, military, aging adults, trauma, discrimination, stigmatization experiences. Trying to think of any, you touched on so many, but there's so many unique experiences that play into mental health and specifically like suicide that it's hard to, say like, oh, well, what was this one thing or what was the catalyst here? And really, it's not a simple answer. We're comprised of all these experiences, and we do have these preventative factors as well, which help to keep our wellness, and help to keep us safe and healthy. And I have, like for youth, right? Mentors, having a safe space, school engagement, community engagement, structure and stability at home, and a safe family relationship. Adults, you touched on a lot with diabetes, that some of those same things that you would do for the diabetes, you can do to promote wellness with your mental health. This eating balanced meals, having exercise, additionally like sleep, and having that support, again, community support, natural support systems, and people that you can turn to.
Definitely. What do you guys? Oh, go ahead, Kimmy. I'm sorry.
No, that's okay. I was just going to, this slide is absolutely perfect for for what I was going to mention. I mentioned early on about just that whole person approach. So even things as making sure we're trying to get enough sleep, we're staying hydrated, and like we need to. All the little, and again, I don't want to say little, but just those basic things that sets us up for success. And also to remember that this crosses so many different boundaries. We talk about socioeconomic boundaries as well, but also educational boundaries. We've some of the people in different careers, not just the celebrities and things, but especially high achieving people, or people who are in higher ed. Um, yeah, people who it's just something that touches all of us. So again, I love that saying of check on your strong friends, and that mask that we put on, that I'm sure everyone on this call, this webinar, those watching, there have been points where for us to navigate the world, we've had to wear this particular but we also have to make sure that around the right people, and that we are in environments where we can take the mask off, because we have to take the mask off, and hopefully be able to move and navigate those environments where we felt that we had to have a mask, where we don't have to put the mask on at all.
Definitely, definitely. I love how you mention environment. Being cognizant of the environment that you're in, whether it's an academic environment or whether it's a work environment, is super important, because sometimes the environment that you are in, the work that you are doing, is indirectly negatively impacting your mental health. Just speaking from my own experience, the training that a person goes through to become a physician, to become a resident, etc., they purposefully teach you to be strong, tough it out, suck it up. Don't complain, irrespective of what's going on. And so this is part of your training. So you are indirectly learning, it's becoming inbred that you can't complain, and that if you complain, you're viewed as weak or incapable, and that ungrateful, exactly. And you compound that within our culture of Black and Brown communities, where we are taught that we are supposed to be smarter, that we're supposed to be stronger, that we're supposed to work harder, that we're supposed to, do all these things, because by race, we are viewed by society as less than already. So you compound that pressure with what you're indirectly being ingrained in the workplace or in the training place or in the school place. And before you know it, you are already set up for being at risk for mental illness before you even start. You know what I mean? Ironically enough, the myth that suicide doesn't happen in Black and Brown communities is so far from the truth. The highest number of suicide amongst age categories are Black and Brown teens. That blew me away. I had absolutely no idea. And in fact, worldwide, particularly since COVID, the rates of all suicides have almost tripled. Things that we need to remember is that a lot of times the root, in addition to what I mentioned about how we're raised and the environment that we're in, is stress. With respect to well-being, we have to recognize that stressors, everyday stressors, whether that's financial stressors, whether that's family stressors, each individual stressor needs to be addressed. You need to examine whether this stressor is negative to the point where you have to get to the root of it, or whether it's a stressor that is something that can be managed on an everyday basis by something as simple as 15 minutes of quiet time, or 15 minutes of self-care every day, or taking a bath at night, whatever. But recognizing stress, because if stress is not recognized, it becomes toxic. And then resiliency, or the ability to become resilient, gets harder. And then those stressors, when they seem random, they start becoming erratic and compounding upon each other. And what you're basically teaching your brain is that this is normal. So then your brain starts to normalize these stressors. And then that's when the physical manifestations start to happen. So we want to make sure that from a well-being standpoint, that we recognize what stressors are, that we recognize the need for self-care habits, that we recognize the word no. No is an action, it's a verb, it's a complete sentence, no. Or as my best friend says, I'm sorry, I do not have the capacity to entertain that at this moment, period.
I love it. I love that.
But have the courage to do something and say something. Two examples I can give is Simone Biles, Naomi Osaka. They basically said, to hell with the world, to hell with the Olympics, to hell with competition. I have to get this right, because if this is not right, then my performance is negatively impacted. I can go on about this, but
Yeah.
yeah, what are your guys' thoughts?
You touched on something there, because even positive stressors, big life events, those can also contribute. So it's not necessarily, people think, oh, financial, I'm going through a hardship, but, large events, making it to, to a milestone, and other big life events. Sometimes, one of the examples they use is like weddings, graduation. So really significant, impactful events, positive and negative.
What are your thoughts, Kimmy? Any thoughts on that?
Uh, I know for once I actually no. I'm absorbing it all in, and I,
Um,
I I'm just so grateful that we have this forum to be able to discuss this. And I'm kind of chuckling when you said that you could go on. Yeah, we could definitely go on. There's
so
definitely
much. It's just so much. Yeah. This slide I definitely want to bring up because it's multifaceted in my opinion. A lot of times self-care involves hair, for women as well as for men. But recently, that part of our self-care, that part of our culture, that part of our expression, our physical appearance has come under attack. And there is an issue going on in Texas now with this young man in the middle here, this beautiful young man who's being punished because of his hairstyle. I think Tiffany, are you in the background? Can you tell us more about this story? I think this is so important to point out about what's going on with this young man in Texas.
Yeah, absolutely. So many of us are aware of the Crown Act. It was passed to protect against discrimination as it relates to hair, particularly in schools and in the workplace. And this most recent case, and I say recent, although it's been going on for quite a long time here in Texas, has really kind of tested the limits of the Crown Act. While it was at the federal level, Texas also individually passed the Crown Act for this in the state legislature. But this really hits close to home for a couple of reasons. One, it's happening in my backyard. I'm in Houston, and this is happening in a Houston suburb. And two, I am in the education field. So seeing this happen in a school has been really troubling. Recently, this ruling came down where the judge said that the school district was correct in saying that the boy's hair violated school rules. That ruling just came down today. There was a press conference that was held kind of immediately after with the family, with his lawyer, and the young man spoke. And I think his words really said it all. He shared that he felt very lonely. He felt like he was on an island by himself. He said he felt isolated, and he was watching all of his friends really enjoy their time, being able to be kids, to laugh, to play, while he was confined to a singular room by himself. And that the people who were in a position to protect him and to ensure that his needs were met, both in terms of his education, but also in terms of his emotional and mental needs, were the source of the anguish, because they are the ones who are pushing against him. I want to be mindful of time, but just one last piece that I will say on this topic is that this school, I think, intentionally has been using this boy as an example. Initially, when this first came to court a while back, the idea and the argument was that his hair was in violation. When the district realized that that was no longer kind of a winning point, the argument became that the length of his hair was the problem and that they really were going to make an example out of this young man. And so I think it just kind of goes to everything that you all have been speaking to about the importance of protecting our well-being, both physical and mental, and understanding that, we're not always going to be okay, and we have to prioritize our needs sometimes. And that sometimes means that we have to kind of look inwardly, and we have to look to our families and those around us for our support system. So. On mute.
Not technically savvy. Thank you for that story, Tiffany. That saddens me and that angers me as a mom and as a provider. I immediately, putting those two hats together, I would like to issue a call of action to this community watching this, whether you're watching it live or whether you're not, to somehow send words of encouragement to this young man, because what he is experiencing is active trauma. This is trauma on top of him being a Black male in today's society. And he is going to also suffer from micro traumas, meaning anytime he hears about the Crown Act, anytime he hears about anybody else having this issue with their hair, anytime anything negatively, adversely affects him as a young Black man with it looks like dreads or locks, he is going to relive this trauma over and over and over again, similar to the imagery that we as a culture and community saw with the George Floyd incident. These are micro traumas, and whether you know it or not, you are mentally impacted by these micro traumas and these stressors. And conversation is, again, the first step towards managing them. And the other thing I also want to point out in sort of a call of action form is for us to recognize that there is a disadvantage already in our culture and our community with respect to access to healthcare, with respect to access to certain well-being things. Well-being things cost money, right? Whether that's therapy, whether that's a psychologist, whether that's medication. A lot of people can't afford insurance. And also too, eating right, eating well, nutrition, that is expensive. You know, organic food is expensive. Not everybody has access to it in certain communities. And if you look across the country, certain communities have certain restaurants and certain grocery stores and other communities don't. Why is that? So I think dialogue is important with respect to recognizing the inequities, with respect to recognizing signs and symptoms within ourselves, with respect to conversing about what's going on within you, and then for us to be able to collectively help each other. So I guess prior to me bringing on my colleague, Pat, I would like to have a call of action. The first call of action, or the first thing that I would like to place upon our audience and even our panel, is every day, do one thing for yourself. Whether that's journaling, pen and paper is cheap. Whether that's meditating and sitting in silence, whether that's manifesting, these are all free things. Do one thing for yourself every day. Number two, reach out to somebody. There's a friend you haven't talked to, somebody who fell off the face of the earth, a grandmother. Reach out to somebody, share this information that you learned today, and ask them to then pass it on to themselves. And then the third I'll reiterate is this young man in Texas. I don't know how you can communicate with him. I'm sure there's a way to send him letters, but sending him words of encouragement will help to counteract all of the negativity that it seems as if he's immersed in on a day-to-day basis. So as a physician, I'm really imploring upon you to let's help save this young man, because I feel in my spirit that perhaps he's at risk. Pat, you want to come on and close us out? This has been fantastic, you guys. I can't believe the time has gone by already. I almost feel like we should have more of these where we just kind of talk about what's going on with health and wellness with each other in our communities.
Absolutely.
And so forth. Yeah.
Well, thank you all for your wisdom, your amazing lived experiences in your respective careers as practitioners, and for the call to action, right? So, in as much as you all spoke about advocacy tonight, what I also heard, sort of from a latent perspective, and even a little bit more explicitly nearing the end of the conversation, was activism, right? So the ways in which, yes, we advocate for ourselves, but we also need to be passive, if not forward, in our activism for others, particularly others that can't speak or don't have the vocabulary or diction to do so. So with that being said, I will formally introduce myself. My name is Pat Parks. I am class of '01, and I serve on the Notre Dame Black Alumni Board as the Student Relations Director. And again, I just want to say thank you so much for the time tonight. We appreciate everyone's time, insight, and commitment to our mission. For those of you who tuned in and asked questions, thank you for your time and engagement as well. Please note that we will share the resource links provided during the panel tonight with you as well. We look forward to seeing you again next week for the final week of our Black Domer series. We have a great session in store with an in-depth discussion about Black spirituality. Please feel free to share this series with your friends and your family. We are accepting registrations throughout the entire month at think.nd.edu. In addition, it's not too late to check in with your local clubs. Many are hosting Black History Month events in your area, and we highly recommend that you attend. For example, the Notre Dame Club of New York City hosted an in-person event today called Cheer Cheer, Reflections from Trailblazing Black Notre Dame Alumni. We highly encourage you to get involved. Each club received a Black History Month toolkit curated by the BA of ND to support their Black History Month activities. Please inquire. All right. Again, I want to extend a special thanks to all of you for your engagement, and we look forward to seeing you next week. Go Irish.
Before we end, I just want to offer my services in the form of, if anyone has a medical question, you can consider me a second opinion as a former alumni. Please email me hello@drlegree.com, DRLEGREE. I'm not your primary care provider, but I can offer assistance in the form of a second opinion. And I'm here for you. Thanks, guys. Thanks for joining.